Hi, my name is B. I'm going to be your nurse practitioner today, and I'm here to do some part of your abdominal and your muscle test. What's your name?
Blaine?
Blaine. I'm going to have you read this, so if I could record it
Sure.
during the assessment. Thank you.
I give my consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of assessing the student competency in the advanced health assessment course at MU.
Thank you. So the first thing I'm going to do is inspection. I'm going to have you lay down on the bed. So the first thing I'm going to do is coming in, doing the inspection. The first thing is just checking to see the abdominal at an eye level. I'm also checking to see for the contour, symmetric hair distribution. So the patient noting any scars or masses or lesions. So patient does have scar on the right side of the upper quadrant of the abdominal, and also moles on the left side of the upper quadrant. But I also see striae. The mother is, I meant to say the patient. The patient is a mother of two. So I'm going to go ahead and move on to auscultation, which is the next step in the assessment. So I'm going to go ahead and listen to all four quadrants of the abdominal wall with the diaphragm, and I'm starting with the right lower quadrant. All right. Upon auscultation, all four quadrants are normal, active, vowel sounds. I'm also going to listen to the aorta with the bell side of the stethoscope. I'm listening to the renal arteries, left side, right side. I'm also listening to the iliac arteries, left side, right side. I'm also checking for the femoral pulse, left side and right side. All right, I'm gonna move on to, and upon auscultation of the arteries, there is no vascular sounds. I'm gonna go ahead and move on to percussion. And upon percussion on all four quadrants, it's tympanic. I'm also going to move on to palpation. With the palpation, the first thing I'm going to do is light palpation. Are you feeling any pain or tenderness?
No.
Any pain or tenderness?
No.
And I'm going to move on to deep palpation. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Thank you. All right. Right before I forget it, I'm also going to percuss in the liver area, which is a little bit dullness upon percussion. I'm going to move on to palpating the liver. I'm going to go ahead, have you take a deep breath. If it's not palpable, I'm also just going to check for the hepatojugular reflex, which there should be an increase in the jugular venous pressure, and the increase should be between 3 to 4 centimeter increase. I'm also just going to go ahead and palpate the spleen, which is not palpable. It's not palpable. I'm also going to go ahead and palpate the bladder, which is not palpable. The kidneys on the right side, and kidneys on the left side. All right, I'm gonna check for the rebound tenderness. I'm gonna have you take a deep breath. All right, are you feeling any pain?
No.
All right, patient is not complaining of any pain. If she was complaining of pain, I would have been indicative of peritonitis. I'm gonna move on to checking for Murphy sign, which is checking for the inflamed gallbladder. I'm just gonna go ahead and palpate. And are you feeling any pain?
No.
All right, I'm gonna have you take a deep breath again. Patient was yawning, sorry. Murphy sign, patient is not complaining of any pain, which is a good thing. I'm gonna move on to checking for the Mick-Berry's sign, which is located just 2/3 of the umbilicus on the right lower quadrant, right above the iliac. Are you feeling any pain?
No.
All right, patient is not feeling any pain. I'm also just gonna go ahead and check for the iliopsis test. If I could just have you in a reclined position. Yep, just reclined position a little bit like that. And I'm gonna lift up your leg. Are you feeling any pain?
No.
No. All right, I'm also just gonna check for arbitrary test, which lifting up the patient's. Are you feeling any pain?
No.
Both of them, if the patient is feeling pain on the groin area, that could be an indication that there is muscle issue going on. So I'm just gonna go ahead and move on to checking to see for the patient's muscle. I'm also just checking to see visibly. The first thing I'm gonna do is just inspecting the patient's joints. Patient's joints, I don't see any discoloration. I'm also just gonna go ahead and start palpating. I'm just gonna start off with the temporomandibular joints. Are you feeling any pain?
No.
All right, temporomandibular. I'm moving on to just, are you feeling any pain?
No.
Joints in the wrist, knees, ankles. Are you feeling any pain?
No.
Okay, go ahead and range of motion. Go ahead. Thank you. I'm also just gonna have you sit up for me. Sit down on the bed. And if you could just move that way. I'm checking for the, tilt your body like that. Thank you. Checking for the CVA tenderness. So I'm gonna do this so I can find. Are you feeling any pain?
No.
No pain. All right, if I'm gonna have you face me, checking for Phelan test, if I could have you do this. And what I'm checking for is the carpal tunnel syndrome. If the patient is complaining of any paresthesia or any tingling in the thumb or pain. Are you feeling any pain?
No.
No. Thank you. And I'm gonna have you, just give me your hands. Normally I would do it on a surface of something, but are you feeling any pain?
No.
This is the Tino test. It's also checking for the carpal tunnel syndrome. And if I could have you lay down on the bed. I'm checking next. I'm going to check for the bulge test. This is just to see if there's any accumulation of fluids in the knee area. All right. I don't feel any fluids running through the knee joints. Checking on this side. I also don't feel any fluids running through. I'm checking for the abutment of the patella. I don't feel any fluids running through the joints again, but the knee joints. All right, on both sides, I don't see any fluids running through. All right, lastly, I'm gonna check for the McMurray's test. Just gonna lift up your leg. Are you feeling any pain?
No.
Are you feeling any pain?
No.
All right, I'm just gonna check on this side. Are you feeling any pain?
No.
Right, patient is not feeling any pain, and that would complete my test. Thank you.